this case, some nuances with the previous case that we had discussed is the fact that the patient presented with a large liver lesion that had main portal vein invasion. So the presence of a large lesion with main portal vein invasion is a contraindication to surgical resection, despite the fact that the patient had Child-Pugh cirrhosis. Again, this is because of the poor prognostic impact of main portal vein invasion. The other general impression is that the patient was started on systemic therapy appropriately, given the presence of main portal vein invasion, and had stabilization of disease initially, but that was short-lived with progression in April, so about 3 months later with the presence of extrahepatic metastases. So this generally kind of is a suggestion of a relatively aggressive course of disease. Patients like this are diagnosed with hepatocellular carcinoma in various types of settings. Patients who are undergoing appropriate screening because of their diagnosis of hepatitis C tend to have the diagnosis of hepatocellular carcinoma made earlier with earlier stages of disease. Unfortunately, many patients do not undergo routine surveillance as indicated and either present with symptoms that lead to imaging or are seen by a hepatologist usually because of recurrent hepatitis C, such in this case, or elevated liver enzymes. And at that point, the hepatologist orders imaging, which, as in this case, showed incidental hepatocellular carcinoma. There is no indication for histologic confirmation in all cases of hepatocellular carcinoma because there are accepted radiologic criteria for diagnosis, which consist of the presence of arterial enhancement in the arterial phase of the imaging study and venous or delayed phase washout on a multi-phase scan. Histologic confirmation and biopsy are welcome and indicated because they allow us to have more tissue and do more biomarker studies and hopefully advance the field in that way, but they're not necessarily required for routine care and diagnosis. Another question that arises nowadays is with the new available treatments for hepatitis C is whether a patient with hepatocellular carcinoma diagnosis should have their hepatitis C treated. Unfortunately, this is an area that warrants additional investigation. We do not know at the present time whether treating hepatitis C will alter the patient course once they have a diagnosis of hepatocellular carcinoma and are undergoing anti-cancer therapy. So the short answer is we do not know whether treatment of hepatitis C will make a difference. And there are also some controversies arising now, and this is an area of active investigation, whether the treatment of hepatitis C may accelerate the progression of hepatocellular carcinoma or recurrence in certain cases. So again, it's an area that warrants further investigation, and all I can say is there is no clear indication to treat the hepatitis C once there is a diagnosis of hepatocellular carcinoma.